Well, shortened antimicrobial treatment for acute otitis media in young children. First, definition. AOM is acute inflammation of the middle ear and may be caused by bacteria or viruses. A subtype of AOM is acute suppurative OM, characterized by the presence of pus in the middle ear. In around 5%, the eardrum perforates. Now we have a video.
Acute otitis media is the most common indication for which children in the United States receive antibiotics. Current guidelines recommend a 10-day course of antibiotics for children under 2 years of age. But given the growing concern about antibold who had acute otitis media during diminished activity, diminished appetite, and fever, the primary outcome was clinical failure, defined as worsening symptoms or otoscopic signs of infections were found. Adverse events such as diarrhea without reducing adverse events.
Well, now we have applications in medicine. Pharmacotherapy, like amoxicillin, coagulant, trimethoprim, sulfamethoxazole, cefixime, and etc. Surgery, tympanocentesis, myongotomy with insertion of ventilating tube. Now we have all the video. Remember, we are vegan. Vegan.
If you are a parent of children under 5 years of age, then this video should interest you. As a parent, you most likely have heard about or experienced glue ear or otitis media with effusion. For those who haven't, glue ear is a common childhood condition in which the middle ear becomes filled with a sticky fluid. Sounds familiar? That's because glue ear is the most common episode of glue ear before they are 4 years old. If your child experiences surgery.
Well, pros and cons. First, pros. Clinical success occurs in more than 60% of patients, even when bacterial eradication is not achieved. Eventually, almost all patients improve. And cons. Many children with AOM don't benefit from antimicrobial therapy, either because the illness is not bacterial origin, or because the immune system clears the infection without use at work. Now we have all the video. Enjoy it.
If you are a parent of children under 5 years of age, then this video should interest you. As a parent, you most likely have heard about or experienced glue ear or otitis media with effusion. For those who haven't, glue ear is a common childhood condition in which the middle ear becomes filled with a sticky fluid. Sounds familiar? That's because glue ear is the most common childhood condition that requires surgery, and it will affect 80% of children. Your child get affected.
Well, issue applied in Ecuador. More than 2/3 of children will experience one or more attacks of AOM by the age of 3, and about half experience more than 3 episodes. More than 75% of episodes occur children under 10 years ago. 10 years of age. Now all the video. And finally, conclusion. Among children 6 to 23 months of age with acute otitis media, reduced duration antimicrobial treatment result in less favorable outcomes as standard duration treatments. And now the last video.
Itis stands for infection and inflammation, while media stands for middle ear. So, acute otitis media means inflammation of the middle ear. What are the stages of acute otitis media? 1. Stage of tubal occlusion. Since the middle ear drainage is entirely dependent on eustachian tube. The first step in acute otitis media is the blockage of eustachian tube. Children are particularly predisposed to acute otitis media because their eustachian tube is shorter, wider, and more horizontal as rupture. Virus virulence of organisms of deafness. C.
Well, we have finished. I hope you enjoy it.